अच्छा Okay, good morning, everybody, and welcome. My name is Shalini Sinha, and it is indeed a privilege to be part of this session and also to be part of the first session for this important event. So I would like to begin by thanking the organizers for inviting me here. And who's managing the PowerPoint? So how do I, you'll have to teach me. Yes, thank you. My name is Shalini Sinha, and I am the India country representative for WIGO, which is an international network. WIGO is an acronym for Women in Informal Employment, Globalizing and Organizing. It's a global research action policy network. I am based in New Delhi, and we have members all over the world. I'd just like to, I won't go into detail about what we do, just two things. One is the goal and objective, which is to improve status of the working poor, especially women, in the informal economy. And I'd also like to draw your attention to our website, where a lot of information that you may find useful about informal economy and women workers. So www.wigo.org. Next, please. Just a small, just to show you, this is a little bit dated, but this is where we are in terms of our activities and partners and our members. Our members are three constituencies. One is the development practitioners, second is member-based organizations of the poor, women informal workers, and third is researchers. So I'm going to talk a little bit about informal economy, and I'm going to talk, there are three terms which often incorrectly are used interchangeably when we talk about informal work. One is the whole term about informal sector, which technically in a statistical definition refers to production and employment that takes place in unincorporated, small or unregistered enterprise. It's an enterprise-based definition. There's informal employment, which refers to employment without legal and social protection. It could be in informal enterprises, it could be in formal enterprises, increasingly so in formal enterprises in India. And informal economy, which is the term I would be using, combines these two and talks about, incorporates connotations to all units, activity and workers who may be either in the informal sector or informal economy. But what cannot be denied is that this is no exception. The informal economy in the global south is large and here to stay, and any work that we want to do to develop for economic development or for the development and welfare of the women workers needs to engage with the realities of informal work and informal employment. Having said that, we need to understand that informal employment is not a homogeneous body. It's not a homogeneous animal, so to say, to speak. It is diverse, and it varies from sectors. It can vary from region and countries also. In the most obvious, most commonly used disaggregation of informal employment, we talk about self-employed, those who are employed, self-employed, they don't have an employer. And we talk about wage employed, those who are in informal wage employment, they get paid for the work that they do. There is an employment-employee relationship. Within these two broad categories also, there are subcategories. So there may be employers in informal enterprises, the owners of informal enterprises who may be employing other wage workers. There are those who are own account who have no employees, sorry, and there are contributing family members, and in some instances, the cooperatives, which are members of informal producer cooperatives, may also come under this category. The informal wage employment can be in an enterprise, it can be in the household, in homes, and it can be for a single employer, it can be for multiple employers. So there the employer-employee relationship is established, but it has several variations to it. But I want to draw your attention to another way of looking at the informal economy, and that is by looking at the place of work of the workers. So without going into the definitional issues, if we just see where the workers are, next please, we'll see that they are in informal spaces, by the road, on the street, on the street corner. They could be in small workplaces, they could be in hotels, restaurants, offices. Now please note that some of these institutions will also have formal employees, but along with that they have informal employees. But the two categories at the bottom are important. So when we talk about informal employment, it is not the normal understanding of a place of employment. Usually when we talk about work and we talk about employers, employees, it is a sort of a formal conception of a place of work, which is a factory or an office. But here you will see that these are informal spaces of informal employment. So home, your own home, which is your place of living, may also be double up as a place of work for some workers. And somebody else's home can also be your place of work, for instance, in the case of domestic workers. The earlier example that I gave, where the place of work and the place of living are the same, that is for the what we call the home-based workers, where women work and produce from the homes where they live. Now, this has very important connotations in terms of, as we shall see, as I will explain, in terms of worker security, vulnerability, visibility, worker status, and gender. And all of these come together. It's not, so there are multiple layers, and these layers interact with each other to reinforce vulnerability and exploitative situations. So if we are looking at informality in developing countries, then one of the common connect that one makes is with poverty. Now, all informal workers are not poor, but large number of informal workers are poor, and large number of the working poor are informally employed. Yeah, and as a result, the earnings are low, the costs and risks are high, and they are vulnerable. If you are going to impose the gender lens on informality, then what comes out very clearly is that a larger number of women as compared to men are working in informal employment, and even within the informal employment, there is a ghettoization of women into at the bottom of the pyramid, where they are working in conditions which are far more exploitative and where the risks are higher. The other connect that I want to make is also informal economy and cities. So informal economy is the broad base of urban workforce, enterprise, and output. But despite that, the city development trajectory, unfortunately, sees them as more like nuisance, and their nuisance or does not recognize their contribution to the city economy, and therefore there is an increasingly hostile environment which adds to the vulnerability of the worker along with the other socio-economic issues that we are going to be talking about. Now, this is a diagram which we have at WIGO have developed through our work across countries, where we talk about segmentation of the informal economy. And if you look at this pyramid, you will see that if you look at the poverty risks, which includes the health risks, as you go towards the bottom, the poverty risks increase, but it is at that end, also at the bottom, where the earnings are the lowest. So at the bottom of the pyramid, the risks are high, the earnings are low. Now, if you look at the other side of the pyramid, you will see that is also where the women are concentrated. So large number of women are there. Just some figures to tell you about urban employment in India. This is based on the national survey, which was 2011-12 latest. That is what we have. We have a more recent, smaller survey, labor force survey, which is, the numbers are just coming out. We have a few reports, but we are still relying on these. And there are two numbers that I want you to look at, which is for women, which is 32% of them are working from home. Home is a place of work. We talked about it a little bit earlier, and the large number of informal workers. Next, please. I also have these numbers from different cities. Again, the source is the same, NSSO survey 2011-12, but there are two distinct things that I'd like to point out over here. One is, if you look at what I said earlier when I talked about, this is about women's employment, but if you remember what I talked about, home as a place of work, and domestic workers who work in others' homes, and home-based workers who work in their own home, and you will see the large number of women who are concentrated in these homes as workers. What is also, I wanted to just also highlight the diversity across cities. So that needs to be factored in. Some of it is also measurement issues, women's work and measurement issues. And we can come back to that later, but just to point it out over there. So when we look at women informal workers, we see that their identities are multiple, and each of them reinforces and works together. So they are workers, and within that they are informal workers. They are workers in a particular sector, for instance, construction. So there they would have the similar kind of challenges that any other worker, along with their male counterparts. They may be members of particular groups, they may be migrant workers coming into cities, and those sets of challenges happen. They are residents of slums or squatter settlements, and that again has implications. It is often assumed that may have implications on their health, but the implications on productivity and income and security, and the combination of all three of them, I think, needs to be highlighted over and over again. Therefore, when we plan cities, when we talk about planning of the cities, we need to understand that place of work and place of living have an implication on livelihood and poverty elevation at the city levels also. Within their own homes, they are women, and all kinds of patriarchal norms that they may be, and social constraints that they may be working with. Increasingly, so each of these we can talk to, and I'll come back to it when I do a concluding remarks after the presentations. But I want to quickly dwell on two things now. The care burden of women in India. We are grappling with falling female labor force participation, but we are also seeing an increasing time poverty of women. So it's important to dwell a little bit on the care burden of women. And it's not as if the women just fall out of the labor market when the care burden becomes too much, or when they have young children, or when they are pregnant. It's also when they start coming back, the kind of labor market decisions that they make is clearly dependent on their care responsibilities. And therefore, it has an implication on where they choose more flexible kind of work, low paying work, and which then starts a vicious cycle of low income, low care, poor health, etc. And then the responsibility of unpaid care work, of course, needless to say to this kind of audience, generates and reinforces social inequality that we constantly talk about. Next, please. The next thing, before I sort of start winding up my introductory this thing, is about health of informal workers. Now, there are two things. Health is very important for informal workers because it is their income relies on their good health. They need to be in good health to do the kind of physical labor that they are doing. But the kind of work that they do puts their health a lot at risk in many different ways. So I think that connection needs to be made over and over again. And for women, many of them, their most productive years are also their reproductive years. So the kind of vulnerability that imposes on them when they are having children, or when they have young children, or when they have to care for old or elderly. So those kind of care responsibilities that I talked about, I think we need to understand that even in the context of health. The other thing is where they live and where they work. I think that has a very important aspect, and we all know about it. On both the kind of health environment and social determinants of health that happens. But the other one, less talked about, particularly in the context of informal economy, is the whole issue of occupational health risks. Many workers work in the kind of work they do, and the arrangements of their work imposes many kinds of occupational health vulnerabilities, which needs to be factored in. So I'm going to, so in terms of women, when we're talking about women, they face, as I said, a much greater and challenges. The numbers have shown us that they work more at home, on streets, more vulnerable places. They are more likely to be assigned the most menial tasks, even within sectors where they are gender disaggregation, and they are conditioned to assume the primary responsibility of caring for the young, the combination of all these. And of course, they work long hours in paid and unpaid work, so that has implications on their health and well-being, and on the various other kind of choices that they make about skill development or investing in business or business development. So I'm going to stop here, and maybe this is something that I'll come back to a little later, and invite my co-panelists to introduce themselves and then make the presentations. I think how we are planning to do is, will you go first? So I think Divya will go first, and then Antara, and then Mewaji, and then we'll come back to finalize it, and we'll then open for questions.
Good morning, I'm Divya. I'm a postdoctoral researcher here at IHS. What I'm going to present today is based on my work here. This is an ongoing project where I'm looking at maternal time use and breastfeeding practices at construction sites. Shalini has wonderfully laid out the base for a lot of the conversation that I'm going to have ahead. The construction sector is a fairly peculiar sector. It is amongst the largest employers of informal labor in the country. We know that it employs approximately 50 million people, so it's a fairly big sector. There is about 10 million women work in the sector. And what I learned very recently is also that women in construction sector is quite peculiar. It's very South Asian in that sense, and we find it in very few parts of the world. What was really the objective of the study was to try and understand how women's time, both in terms of paid and unpaid work, that there was very high level of undernutrition both among mothers as well as children. There's no access to social protection, which Shalini also talked about. Women worked very late into pregnancy, like almost into the 9th month of pregnancy, and then came back to work within 2 to 4 weeks of delivery, which had huge implications for breastfeeding practices. And I'll touch upon that as we move ahead. And in the previous work that I did at construction sites, women constantly stated that lack of time was the major constraint because of which they reduced breastfeeding. It was very infrequent and inadequate, and lack of time was constantly, the major reason that was given by women. So we wanted to sort of explore this a little more. What does this lack of time mean for a woman at the construction site? I also want to say that this question was both an empirical inquiry, so we set out to find information on time use and breastfeeding, but it was also a methodological exploration. Because previously I had used qualitative research methods, but I was also really curious to see how time use itself would play out in a sector like this. And so then we wanted to test two different ways of looking at time use, and I'll talk about it a little ahead. One of the other things to note about women in construction work is that often they come from the socio-economically marginalized communities. A large number of construction female workers are from tribal communities. They are seasonal migrants, which means they come to the construction sector, to the construction site for a few months, work there, go back home either for a festival or if there's an important occasion back home, there's harvest, there's sowing season, but they come back. So there's constant migration between the city and the village. But there's also high mobility within the city because they're moving from one construction site to another. That imposes very big challenges for researchers because how do you do research with communities that are constantly moving? But it also talks about their level of vulnerability and the precarity of their work circumstances. In terms of maternal time and breastfeeding, we already know that breastfeeding is absolutely critical both for the mother and the child. Their health indicators are very dependent to, tied to breastfeeding in the initial months. The double burden of paid and unpaid work, which Shalini also talked about, imposes acute time stress on women. Time poverty is another word that is also used in this regard. And in the first 6 months, because the child is biologically dependent on the mother for breastfeeding, it imposes additional burden on the mother. We also know that because it is time intensive, it is very economically expensive for the mother because if she has to take a break from work, that imposes an economic burden on the family. And so then there is a relationship between time poverty and her ability to breastfeed. For mothers in the informal economy who don't have additional care support, under those circumstances, breastfeeding then becomes really unsustainable. And this study sort of tried to understand that a little more carefully. In the literature, there are these broad frameworks that are used to talk about breastfeeding. So we know there is theory of planned behavior, which talks about cultural beliefs, maternal attitudes and so on. Self-efficacy framework, which then talks about awareness, mother's intention to breastfeed. There are social, economic, and maternal and household factors that talk about, slightly larger issues at the household level about economic status, mental well-being, and so on. And there is, of course, some literature on maternal employment and breastfeeding, but a lot of this literature is in the formal space. We know very little about how women in the informal economy then breastfeed their children in the absence of social protection. So things like daycare facilities, paid leave, when all these are absent, how do we then talk about breastfeeding? So there were 3 categories that we tried to capture. There was paid work, unpaid work, and no work, which is typical of how a time use study is done. And I'm going to move slightly faster because I'm running out of time. There were 2 formats that we set out to test. There was a 24-hour recall, which is the standard way of using the time diary, where populations that is being studied generally are requested to maintain a diary of every hour or 30 minutes that they spend. But in this case, because it's a low literacy population, writing was not an option. And so we had to depend on recall. And then the other one was to do shadowing, where we shadowed women throughout the day. and then took notes based on the on time to understand how they spent their day on paid work, unpaid work, and no work. I'll come back to this if there are any questions, but there were, vast differences in the way shadowing and recall worked. Where shadowing, we could get literally minute by minute account of what the woman did in terms of how much weight she carried, how much rest she got, how much water was she able to consume through the day. But in the recall, these are things that women were unable to sort of talk about. And this also imposes huge methodological questions because recall has been considered to be a gold standard largely in many, many studies, especially in the public health field where recall is very often used to talk about morbidity. There's a 2-week morbidity recall, there's a 24-hour food recall. So we also wanted to sort of test and challenge some of those assumptions in testing time with women. The thing about shadowing is, and I'm just going to focus on shadowing as a method now, the thing about shadowing is that it also gives you very interesting insights into other things that you did not set out to study through your primary question. So my initial question was to understand breastfeeding practices and maternal time use and breastfeeding practices, but once you enter the site of work, you also realize there are so many other factors that shadowing allows you to sort of pay attention to. For us, the thing that really stood out, and when I say us and we, I am actually talking about my research assistant and I, who spent a lot of time at construction sites. One of the most important things that we realized was women's nature of work, what work they did on that particular day, the contractor's role, the site rules as they were, and wages were all tied to her breastfeeding practice for that particular day. So it would change, it wasn't the same, but on that particular day, what she did, we tried to note that. And there was some really interesting insights. So when we talk about nature of work, and just a quick thing about how women's work is defined, just the language of how women's work at the construction site is defined, right? So women, suppose you're carrying cement bags, which are about 50 kgs each, and through the day you would do about 100 such bags. But at the construction site, this work in Gujarati, which is the local language in the city of Ahmedabad, it's called chutak kam, which is small work, menial work, miscellaneous work. And that sort of translates into her wages as well. Because she's doing menial, small, miscellaneous work, she won't get the full minimum wage, but slightly lesser than that. And that then has an implication on the way she breastfeeds. Because she on those days that she's doing chutak kam, she needs to work more to be able to get her wage, and so she will breastfeed lesser. So there's an intrinsic relationship between the kind of work she's doing that day, the wages that she knows she's going to get that day, and the number of breaks she can take to breastfeed her child. Same with the site rules. Some rules allow you to bring your child to work, some don't, because there is a daycare and they're very strict about having no child at the site of work because there's a liability on the builder. And so some of these rules also play out. And the contractor's role is also really critical because at the end of the day for the women, it's about the benevolence of the contractor. If he allows her to go breastfeed her child, she can go. And that was really tied to the way she understood her time at the site of work, because it was on the contractor. He would say, you have to finish this much work in the next few hours and only then you can take a break. So that sort of came out quite evidently in our shadowing. And maybe then, since I'm short of time, I'll come back to some of these. I really wanted to put this picture out because this is how I understand the construction sector. Very heavy presence of women, especially in the city that I'm studying, because it also has a tribal population that comes from the neighboring cities, or neighboring states. But at the construction site, women's work is completely invisible. Their wages are dependent on this invisibility because they are not seen as workers, but only as helpers, as miscellaneous workers. Their wages are also accordingly decided. This was a picture of a woman who carried cement bags through the day. And so she was able to take only 2 breaks for the entire day, starting from 9 o'clock in the morning to 6 in the evening to breastfeed her child. And maybe I'll just run through some of these are the various kinds of tasks that women do. I want to particularly focus on this. The picture is not too clear, but that's her husband, and she's carrying cement on her head, and he's sort of plastering it on the walls. This work is called Jodi Ka Kaam. That means they work together in a pair always. And as a result, every time she takes a break, the husband has to take a break because he can't work without her. And as a result, on days that the woman does Jodi Ka Kaam, her breastfeeding becomes even lower. because if she takes a break, the husband takes a break, and then it's not about just her wages, but it's also about her husband's wages. So shadowing sort of allowed us to look at these various patterns of work as well and try to understand how this then related to her ability to breastfeed her child. Um, Also, in terms of care practices, there were creches because at all the construction sites that I worked, it was with the help of a not-for-profit organization. In some cases, women took their children to the work site, where breastfeeding was, of course, more in terms of just the number of times they breastfed their children. But we also are very this is also very worrying because construction sites impose a lot of challenges. You know, it's just dangerous. There are falling objects. There's a lot of dust and cement, and you always know that the child is at risk. And also this idea of the older child being brought in either from the village or from a distant relative to look after the child. And it was really interesting to see how the older child played a very critical role in aiding breastfeeding. Because every time the mother took a break, when she dumped all the cement in the lift and the lift went up and she had exactly 4 minutes till the lift came down, the older child would run with the baby to the mother, and in those 4 minutes, the mother gets to breastfeed her child. And these are some observations that we were able to do only because we were shadowing the women. A recall would not have allowed us to make these kinds of observations. I'm going to finish. Just the last slide. Just quick few, reflections on the method itself. And this is something that I'm constantly thinking about because there are huge questions in terms of what is the ethics of using a method of this sort. Firstly, getting entry into construction sites is very difficult because these are highly guarded spaces where you have contractors, large builders, security. So a lot of my work has been possible only because of Ajivika Bureau in Ahmedabad, which is a not-for-profit organization that runs creches at these sites. When we talk of the site as a site of research, the site of work as a site of research, it imposes some real big challenges because you're also constantly negotiating with the contractor, with the builder. These are relationships that you have to maintain very carefully because you want to work with the woman closely, but your entry to the site completely depends upon your relationship with the contractor, and that's one that you cannot goof up upon. I mean, so no matter what you think about the contractor and the way he treats the worker, that's a relationship that you really have to be careful about. The other big challenge for researchers who work with migrant communities is that over time you become embedded in the context. So, when I'm entering a new construction site, it's a new set of workers, new set of contractors, it's a new site. Then my only way to sort of suggest to people there is that I know something about this. And so then you don't get to embed yourself in the community because the idea of community is not, it's not constant. So you, as a researcher, you're then embedding yourself in the context and then saying, okay, now I've worked in construction sites for a couple of years and I know what it means to do chutak kaam, as I was explaining before, or I know what it means when you don't get a full wage. And some of those experiences then help us to build on our research. Unlike in other contexts where a lot of ethnographic and qualitative work is about being embedded in the community, which is not an option here. Things also about things like thinking about consent. When I work with women, but I'm shadowing her, you also have to think about taking consent from the contractor, from the builder, the security guard, her husband, other people who live with them in the same house. So the idea of consent is something that we are always reflecting upon, like as researchers, who is our responsibility to, and how do we exercise this idea of consent? And the last point about this method being extremely intrusive. So though we set out to shadow women for the whole day, from the time she woke up in the morning at 5:30 a.m. to the time she went back home, which could be any time between 6 and 7 or maybe even 8, there were days when we stopped midway, when we knew the woman was uncomfortable, when her husband came and told us, I don't approve of this, or when the contractor told us this is not okay. Because we knew it would have implications on the women. So it's also a call that we are taking on the site as we do research. And that also throws up this question of the sanctity of the method, because we know that that's something that we're always worried about as researchers. But here we're always trying to balance, have that careful balance between what is that method that we want to follow to our best ability, but also make sure that it doesn't in any way sort of override the agency of the participant and her ability to say, I don't want you to be following me today. I think I'll end there. Thank you.
name's Antra. I have been working for the last 5 years on intersections between informal work, women and well-being in cities. And I work here at IIHS with a research group that works on urban health. So the work I present from today is, it started, the primary questions were, what are the factors that affect exclusive breastfeeding among women workers who work in the informal employment, and how it affects the maternal stress. When we started looking at the work that was already out there that talked about this particular demography or about concerns of the present MCH health provisions on mothers' stress for various kinds, not only related to pregnancy and delivery, there wasn't much to report on. Or if there was, it was very dispersed. Like there was a paper from 1990, there was something in 98 again, but there was not a lot of body of work out there. There was much more in practice. There are organizations that work on these concerns, but they do not form the formal body of knowledge as in the academic space. So when thinking about why do we know what we know about this and other health inequities in cities, I found a very good work by Gaitonde and their team, which synthesizes on the research that addresses health inequities in India in the last 10 to 14 years. And it reports that the predominant methodology that have been used in addressing health inequities has been from large data sets. And in India, we mostly have NSSO and NFHS. So both of these report on parameters of geography and the economic position, and there's a lot of focus on MCH. Hence, the work that was out there, or the correlations that were made out there, were also on these terms. And there were not enough qualitative studies which looked at the actual mechanisms and pathways of how gender or how your work actually affects your health. There was only a description, and there was only a categorization of who's facing what kind of health inequities, but there was nothing on the mechanisms itself. It also reports that there's very little that is known about the health implications on implications of inequity in health provision on the overall well-being of the population, and it was also very limited in what kind of vulnerable groups it was reporting on. So within IIHS, there is an urban health research group which works on several of these dimensions, and one of the aspects that we're looking at is next slide is was to look at the mechanisms and pathways that exist between informal work and health in the cities. In 2017, we received a funding support to explore maternal and child health in cities, and so we designed an exploratory study to learn mechanisms and pathways that exist between informal work and specifically maternal and child health. And for this, we looked at 4 different sectors of work: domestic work, home-based work, a bartering system of work, and street vendors in 4 different settlements in the city of New Delhi. In the process of this exploratory work, we did come up with about 6 or 7 pathways that could explain the effect of informal work on MCH, and it also suggested a couple of experimental interventions that could be tested out in the field. So, next slide. So the work that I present from, I and Mewaji present from today is a continuation of this work, and in this there are 2 components. A part of this project researches, designs and delivers these 2 experimental interventions that I'll talk more about in a bit. And the second part of it is an evaluation of the feasibility of these interventions, which would be called proof of concept study in the public health literature. And the intention was to not only look at the product, but also the mode of delivery and also the mode of the actual intervention. So the 2 interventions, so from the list of 7 pathways, we selected 3 based on the new sites of work that we picked up in Jaipur and Gurgaon. Today we only present from the Jaipur site of work. And so what we had was we decided to go ahead with communication workshops uh, on how to improve the knowledge around exclusive breastfeeding among women, which would tackle the gaps that were given the cultural knowledge systems and the public health knowledge system would not address, which is what exactly is exclusive breastfeeding? Do you feed water? Do you not feed water? What do you do if you have to go back to work and you cannot take your child back to work? Do you give them other milk? How do you do that? And also to answer what it does or doesn't do to your child when you can or cannot follow these rules, because otherwise women would feel they are being good mothers or bad mothers. And the other was a design solution which would help increase the proximity between the mother and child in the first 6 months of their work. The next. So in Jaipur, we decided to go with a work-based entry point, which in practice meant that we would be working with a labor union, which was set up to represent domestic workers. It has a membership of more than 16,000 people in Jaipur, domestic workers in Jaipur. The two of the reasons to go with this way of entry was to identify and reach out to working mothers, which is different from going to a settlement and then identifying them. Now we were trying to look at working mothers across the city of Jaipur. And the other was to test work-based delivery system for interventions. In the practice of it, it also shaped study design and findings substantially. And today we present from it. We would share preliminary findings and reflections from this work that came about because we chose a work-based entry point into this, which essentially meant working with a trade union in the city of Jaipur. Mewaji here will take us through those findings.
मेरा नाम मेवा भारती है और मैं हिंदी में अपनी बात रखूंगी। मैं उसका ट्रांसलेशन अंतरा या शालिनी जी बताएंगे। जब ये स्टडी हम लोग डिज़ाइन कर रहे थे और उसका जो हमारे सबसे जो मुश्किल जो थी वो ये थी कि हम लोगों ने जो कैटेगरी यहाँ इस स्टडी में जो तय की जा रही थी कि 6 महीने से छोटा बच्चा होगा वो या फिर वो 6 मंथ प्रेग्नेंट होगी, तो वो काफ़ी मुश्किल था। और हम लोग 2008 से यूनियन का काम देख रहे हैं, तो हमारे लिए भी काफ़ी मुश्किल थी कि हम इतनी कैटेगरी की औरतें कैसे खोजेंगे, इतनी संख्या में कैसे खोजेंगे। तो फर्स्ट वाला काफ़ी मुश्किल था। और फिर हम लोगों ने जैसे ही डिस्कस किया, बात की और हम लोगों ने फील्ड में जब शुरू किया तो हमारे सामने लास्ट में जब हम ये पूरा ख़त्म करने जा रहे थे तो और डिमांड आ रही थी महिलाओं की। और महिलाओं ने ये कहा कि हमारा भी कर लीजिए कि इस फील्ड में इतनी औरतें और निकल रही हैं, तो वो आगे से आगे हमको लिस्ट भी दे रही थी। तो ये एक चैलेंज भी था और हमारे लिए एक सीख भी थी कि हम लोग उन तक पहुंच नहीं पा रहे थे महिलाओं तक, क्योंकि वो महिलाएं बिल्कुल न्यू होती हैं, शादी करती हैं और शादी के बाद में वो काम पे चली जाती हैं या शादी से पहले ही काम पे रहती हैं। तो दिक्कत ये रहती है कि उनकी पहुंच जो है वो काम और खुद के घर के बीच में ही रहती है और वो काफी यंग होती हैं, काम भी ज्यादा कर पाती हैं, इसलिए भी वो जो बाकी की चीजें हैं उसमें ज्यादा अपना इनरोलमेंट नहीं रखना चाहती हैं। तो ये एक हमारे लिए सीख थी। दूसरा जो उस स्टडी से जो निकल रहा था वो ये निकल रहा था कि महिला, काम और बच्चा, तो वो तीनों को कैसे देख पा रही है। क्या मैं रुकूं या कंटिन्यू करूं? As you like. हाँ, कर दीजिए आप थोड़ा।
I think the first point that Mewaji brought out was that when they started doing this study, trying to get to find the target group on which this kind of study, where there was what 3 months old, 6 months old children.
They were either pregnant in their 3rd trimester and working or not, or they were had a child between 0 to 12 months and they were working.
Yeah, the finding that group was a challenge to begin with, but by the time they've done this, come to this place they say that they have more and more women are wanting to enroll in this study. So the process of actually doing this study, I think Mewaji wants to say, in itself has been a sort of empowering process in which women more and more want to be part of this study, trying to understand the issues that are being raised.
तो इनके बीच में जो हमने देखा कि महिला, काम और बच्चा, जो तीनों को यदि हम देखते हैं तो वो उसकी पहली प्राथमिकता जाती है अपने काम के ऊपर, दूसरी प्राथमिकता आती है उसकी बच्चे के ऊपर, और तीसरी जो प्राथमिकता कहीं बिल्कुल नगण्य है कि वो खुद को देख ही नहीं पा रही है इनके बीच में, फिर वो घर के ऊपर आ जाती है कि घर में चीजें ठीक ठाक चल रही हैं, बाकी के उनका ठीक है कि नहीं है, तो खुद तो बिल्कुल गायब है, कहीं बिल्कुल नहीं दिखती है। और वो पहले भी मैंने काफी काम किया है फील्ड में, तो मैंने देखा था उनको कि मेरे समझ में आ रहा था कि ये है। तो इस स्टडी से हमको और ये मिला कि वो बिल्कुल ही एकदम शून्य की स्थिति में अपने आप को देखती है, और कहीं ना कहीं उसको ये भी नहीं लगता है कि मेरा हेल्थ क्या होगा। अभी जब शालिनी जी अपने उसमें प्रेजेंटेशन में रख रही थी कि सबसे पहले यदि मेरा हेल्थ है तो मैं इस सेक्टर में काम कर पाऊंगी, नहीं तो बहुत मुश्किल है।
So when we started work, there are three things here: women, work, and child. And in a woman's life, Mewaji says that in her experience, the first priority is the work. The second is the child, and perhaps the lowest and the least priority is herself. And that was coming out clearly. And she also referred to the fact that when we talked about an overview, we talked about how health is critical to doing that kind of work, and women, it also came out as part of this study and work that they were doing.
जब हम बच्चे को साथ ले जाने की बात कर रहे थे, क्या बच्चे को कैरी कर सकते हैं अपने काम के ऊपर ले जाने के लिए, तो वो सबसे पहले तो खुद ही अवॉइड करती है कि मैं नहीं लेके जाऊंगी। उसके पीछे रीजन ये है कि वो बच्चे की कोई सुरक्षा नहीं है, इतना छोटा बच्चा कहाँ रखेगी, घर में वो अलाउ करेंगे नहीं, और यदि कहीं 100 में से 1 या 2 अलाउ भी करते हैं तो उसकी सुरक्षा कैसे करेगी, उसको तो काम करना है घर के अंदर, तो वो अपना दूध तो पिला ही नहीं सकती है, तो दूध नहीं पिला सकती तो ले जाने से कोई फायदा नहीं है। ये उनकी तरफ से निकल करके आ रहा था, और वो देखने से भी लग रहा है पूरा कि ये एक समस्या है। और रिसर्च में क्या निकल के आता है कि हम लोग करेज की बात करते हैं कि करेज खोल देंगे, करेज में रख दो, तो वो करेज वहाँ मुझे नहीं लगता कि कोई उपयोगी नजर आ रहा था कि वो करेज में रखेगी तो भी उसको तो आना जाना है, काम के बीच में से आ रही है जा रही है, आ रही है जा रही है, तो ज्यादा बेस्ट मानती है कि कोई बड़ा बच्चा या घर का कोई मेंबर या उसका हस्बैंड उस बच्चे को रखे और वो जल्दी से जल्दी अपना काम खत्म करके आके बच्चे को दूध पिला सके।
Then the question that we wanted to explore in this thing was whether she takes the child to work to breastfeed. Now, most of the time we find that women, domestic workers, are not willing to take their children to work for a couple of reasons. One is the security of the child. She has to work. Where will she leave the child? And whether the child will be secure and whether she will be allowed to take the child. The second reason is whether the household where she is employed will allow her to take the child to her place of work. And the third was that there was also this, if a creche, if the presence of a creche would help her breastfeed, but even then the women seemed to respond that it may not because they were working in different places at different times, so that she would have to go and feed and come back, and that didn't seem to work. So most of the time what women seemed to prefer was that they would leave the child at home being looked after by an older child or by the husband and go and quickly do their work and come back.
जब उसका स्ट्रेस की हम बात करें तो वो स्ट्रेस उसका हमको उसके इर्द गिर्द दिख रहा था कि डिलीवरी से पहले वो कम स्ट्रेस में दिख रही थी, कि ज़्यादा नहीं लग रहा था कि वो डिलीवरी से पहले उसको थोड़ा एक्साइटेड भी था कि बच्चा होगा और पहला बच्चा है तो और भी ज़्यादा वो था। जब बच्चा होने के बाद में जब वो पूरी समस्याओं को वो कैसे मैनेज करेगी, वो उसको लेकर के काफ़ी स्ट्रेस हमको दिख रहा था। जिनके छोटे बच्चे थे तो वो काफ़ी स्ट्रेस में थी, कैसे रखूँगी, काम पे भी जाना है। और काम का भी ये है कि जिन महिलाओं के घर में थोड़ा आर्थिक स्थिति ठीक है, यदि कोई अन्य पर्सन कमा रहा है या उसका हस्बैंड कमा रहा है और हस्बैंड की भी यदि कोई होटल में काम कर रहा है या कोई थड़ी पे काम कर रहा है, रेगुलर उसके पैसे आ रहे हैं, तो वो ज़्यादा दिन रुक पा रही थी, नहीं तो वो करीब करीब 1 महीना बाद ही वापस काम पे भी आ रही थी।
secure kind of job, then perhaps there were some choices for her. But if he was not, he was in equally vulnerable informal employment, then the mother often returned to work almost a month after. Right.
जब जानकारियों की हम लोग बात करें कि उनको कितनी जानकारी है कि वो जब माँ बन रही है, तो उनको अमूमन थोड़ा वो जानकारी थी कि वो बता पा रही थी कि कोई आंगनबाड़ी से उसने सुना है, या ज़्यादातर वो जो सत्य जो चीज़ को मानती हैं वो अपने घर में जिनके काम करने जा रही हैं और जो मालकिन उसकी थोड़ा अच्छे से बिहेव कर रही है या उसकी थोड़ी केयर कर लेती है, उसकी बात को वो ज़्यादा मान रही थी। और वो कि हमको वहाँ से जानकारी मिली, उन्होंने कहा कि आपको इस टाइम ऐसा ऐसा करना चाहिए, तो वो ज़्यादा उसको एक महत्व भी दे रही थी और ये मान रही थी कि हाँ ये मुझे कहीं न कहीं कुछ चीज़ें सही बता रही है। और दूध पिलाने की बात को लेकर के भी काफ़ी को जानकारी थी, किसी को नहीं थी। इनकी जो पहुंच है वो सरकारी जो भी डिस्पेंसरी है और सरकारी हॉस्पिटल है, जब हमने पूछा कि आप डिलीवरी कहाँ कराने का बात कर रही हो, तो वो ज़्यादातर प्राइवेट में जाती है। और वो उनका रीज़न एक ये भी है कि सरकार का जो जिस तरीके से बना रखा है, और वो जो किसी एक के साथ कोई दिक्कत होती है तो वो पूरा फैल भी जाता है। और वहाँ पे उनका टाइम भी नहीं है, उन महिलाओं के पास में इतना टाइम नहीं है कि वो पूरे दिन लाइन में खड़ी होकर के पहले डॉक्टर को दिखाना है तो लाइन में लगना है, चेकअप के लिए लाइन में जाना है, फिर आपको वापस रिपोर्ट लेनी है तो लाइन में आना है, तो वो इतना टाइम भी उनके पास नहीं होता है। और दूसरा वो सुविधाएं भी, वो पैसे दे के जो सुविधाएं तुरंत ले लेती हैं वो भी नहीं होती हैं, तो वो नहीं जाती है। और आंगनबाड़ी में भी नहीं जाती। हमने देखा कि बहुत कम महिलाएं जो आंगनबाड़ी में जा रही है, वो नहीं उसको काम में ले रही है, न बच्चों के साथ ले रही है, न प्रेग्नेंट है तब ले रही है।
In terms of information, the women said that they had several sources, including some of the information that was informally given to them by their women employers, and they valued that as much. In terms of going to hospital for a delivery, many preferred private. Because of various reasons. The government hospital or the public health facility, one of the questions that is often always raised is about quality, then the time to access it in terms of, long queues to enroll, and the third thing that she said was the facilities that are available at these public hospitals. So therefore, the women mostly preferred to pay and go for private. And in terms of Anganwadi also, the women said that they were not, Mewaji says that they were not going to the Anganwadi. आंगनवाड़ी भी नहीं जा रहे थे आपने बोला ना, हाँ, they were not going to the आंगनवाड़ी before or after also, बाद में भी नहीं जा रहे थे।
और दूसरा हम लोगों ने इसमें ये देखा कि जो रिसर्च में जब आप बात करते हैं उनके साथ में, तो वो हो सकता है कि कुछ चीज़ें नहीं बोल पाती हैं। यहाँ पे ये था कि वो महिलाएं बोल पा रही थी, और उसके पीछे रीज़न ये था कि ऑर्गेनाइजेशन है, यूनियन है, पूरा उसका काम है, वो हम उसके ऊपर ट्रस्ट कर रही हैं। तो उनको उस टाइम ये भी था कि वो सवाल हमसे पूछ रही थी कि इसके बाद क्या करोगे, आप तो लिख के ले जाओगे, ले करके अपना बना लोगे, उसके बाद में क्या होगा। तो हम लोग उनसे बाद में जब हम जा रहे हैं फील्ड में बात कर रहे हैं, तो एक फीडबैक हमारे को मिल रहा था, तो हम भी उनसे बात कर पा रहे थे कि नहीं, हम लोग इसके ऊपर और बात करेंगे, एक वर्कशॉप डिजाइन करेंगे, जानकारियाँ देंगे। तो ये सब चीज़ें भी उसमें आ रही थी। और जब हम लोगों ने वर्कशॉप डिजाइन करने की बात हमने की, तो हम लोगों ने काफ़ी बात भी उनके साथ में की। तो हम लोग ये देख रहे थे कि रिसर्च का जो मेथड था, और जिस तरीके से हम सोच रहे थे कि शायद हम 3 घंटे एक बिल्कुल टाइट वाला शेड्यूल इनके बीच में चला पाएंगे, तो वो बना पूरा कि 3 घंटे का ऐसे ऐसे ये जानकारी देंगे, फिर ये करेंगे, फिर ये करेंगे। जब हम लोगों ने फर्स्ट वर्कशॉप की, तो वो पूरा उल्टा हो गया कि वो नहीं चल पा रहा था। वो जो हम लोग बैठ के बात कर रहे थे और जब हम फील्ड में कर रहे थे, तो वो नहीं चला, और वो सिर्फ 1 घंटे चला। बाद में जब हम लोगों ने वापस फिर उसको रिवाइज और ये सब किया और उनसे फिर वापस फीडबैक लिया, तो ये सब तब हो पाया जब ऑर्गेनाइजेशन था। यदि ऑर्गेनाइजेशन नहीं होता, हम डायरेक्टली फील्ड में जाके कोई रिसर्च करेंगे, तो वो फीडबैक नहीं मिलता है। और ज्यादातर क्या बोलते हैं कि लोगों को भी ये रहता है कि ठीक है, ये जानकारी देना, ये वाली नहीं देनी है, तो वो बताते भी नहीं है, तो वो बाकी की चीजें फीडबैक में निकल के आती है।
Mewaji is talking now about the role of an organization of women workers and what role that it can play in a research like this. She says if it was the research done with the researchers going directly and talking to the women, women may not be able to speak freely. But if it was done through the organization, then women were able to speak freely and had some trust in the organization which was facilitating this research. On the other hand, they also were putting some pressure on their own organization, asking what are you going to do with this research. So there was a conversation going on of how this usage of research and how it could be used to design activities and information exchange. Thirdly, what she is also highlighting is that because of the presence in this kind of a dialogue, the research itself was very enriched, and the process of research, although it had to be modified a couple of times in workshops, but the process of research then became very sort of close to how the women, so that the women could participate in it fully.
तो इसके अंदर एक हम लोगों ने ये तय किया था कि एक बेबी बॉक्स की बात चल रही थी कि कैसे वो अपने बच्चे को यदि साथ लेके जाती है या घर में रखती है तो कैसे रख सकती है। उसके ऊपर काफ़ी डिस्कस हुआ, महिलाओं के साथ फील्ड में हम लोगों ने प्रयोग भी किया। तो उसका ये था कि हमको फीडबैक ये मिला कि इस तरह की रिसर्च जब हम करें तो उसमें कोई भी देने की बात नहीं हो कि हम बेबी बॉक्स दे देंगे या हम लोग आपको ये इस तरह का कुछ देंगे, कि उसका जो रिजल्ट है वो अच्छा नहीं होता है। और वो अच्छा इस मायने में नहीं होता कि यदि हम रिसर्च करके निकल गए और बाकी का हमको कोई लेना देना वहाँ पे नहीं है, यदि हमको वापस नहीं जाना है तो वो ठीक है। यदि वहाँ पे ऑर्गेनाइजेशन है वो काम कर रहा है, उसको करना है काम, तो उसके लिए काफ़ी मुश्किल होता है। और मुश्किल इस मायने में होता है कि आप किसको देंगे किसको नहीं देंगे। जब आपने रिसर्च शुरू किया तो वो बच्चा आपका 1 महीने का था, अब वो बच्चा बड़ा हो गया, या उस टाइम 9 महीने का था, आज वो 1.5 साल का हो गया, तो उसके तो वो कोई काम में भी नहीं आएगा। और काम में नहीं आएगा तो उसको समझाना हमारे लिए इतना मुश्किल है कि हम मेरे को क्यों नहीं उसको क्यों दिया गया। और यदि फील्ड में इस टाइप का एक भी चीज़ होती है तो बाकी की जो फील्ड है, हमने यदि 5 को समझाया तो 20 तो उसके अपोजिट में है, तो वो बड़ी मुश्किल वाली बात होती है। और उनको लगता है कि वो जानकारियां जो होती है कि इसके पीछे रीजन क्या था, हम रिसर्च क्यों कर रहे हैं और हम लोग क्यों ये सब चीजें बात करना चाहते हैं, इनके ऊपर ये दिक्कतें इनके ऊपर, तो वो जानकारी तो दब जाती है और वो एक खड़ा रहता है कि नहीं ये मिलना चाहिए था, ये अच्छा नहीं था, ये बुरा था, तो उसके ऊपर वो पूरी बहस आ जाती है।
So the other issue that she's highlighting is that there was some conversation about designing and perhaps giving of a baby box to the research respondents, and she's suggesting that it may not be a very good idea to do something like that, because there are this is a community that the organization works with, keeps on going back to, and for some reason one family or a few families are no longer eligible for that kind of a product because their children have probably grown up or something. They then start complaining, and it creates an environment of complaint, and the real objective of why the research was being conducted then gets pushed behind. So it's not a good idea to connect these two things.
लास्ट में ये मैं शेयरिंग करना चाहूँगी कि इसका जब हम लोग फीडबैक लिया और वर्कशॉप हुई तो हमको शुरुआत वाली में भी ये लगा कि शायद महिला ही है, इतना छोटा बच्चा लेके आ रही है, अभी इतना सर्दी थी इस टाइम में, तो वो हम लोगों को डर था, पर वो महिला आ रही थी और वो इसलिए आ रही थी कि उसको जानकारी चाहिए थी, और वो जानकारी लेने के लिए और वो लेकर के कुछ जगह हम लोगों ने जब शुरुआत वाली वर्कशॉप की, अब हम लोगों ने फीडबैक लिया पूरा, तो उसमें ये था कि वो कहीं न कहीं उन चीज़ों को काम में भी ले रही है। जो जानकारियाँ उसने ली कि कैसे रखना है, मुझे दूध पिलाना है, यदि मैंने एक बार शुरू किया तो मैं उसको अवॉइड कर सकती हूँ, यदि मेरे को दूध नहीं आ रहा है तो उसके पीछे ये रीज़न नहीं है कि मैं ज़्यादा खाना खाऊँ इसलिए आएगा, कि उसको जानकारी नहीं है। वो जैसे हमने जानकारी बताई तो कुछ जगह हम लोगों ने देखा कि वो उन्होंने शुरू किया और उसका एक पॉजिटिव रिजल्ट भी आया। तो ये इसलिए सब चीज़ें हो पाती हैं कि पीछे ऑर्गेनाइजेशन है और हम डोर टू डोर उनके पास जाते हैं, मिलते हैं, बात करते हैं, तो वो जो चीज़ हमको उस टाइम में उस वर्कशॉप में शायद वो नहीं बता पाएगी और नहीं बताएगी, जो बाद में तो वो पूरा गुस्सा भी निकालती है हमके ऊपर, तो चिल्लाती भी है, काफ़ी बोलेंगी कि नहीं तुमने ऐसा कर दिया, हम नहीं चाहते थे कि ऐसा हो, या अब की बार नहीं आएंगे बिल्कुल भी, आप कुछ भी कर लेना, मीटिंग में नहीं आएंगे। तो फिर हम लोग बात करते हैं, वो खुला बोलती हैं खूब, अंतरा जी को, इनको तो पता है कि वो बोलती हैं हमको कि नहीं आएंगे, अब की बार बिल्कुल नहीं आएंगे दीदी, कुछ भी कर लेना। फिर हम समझाते हैं, बात करते हैं कि क्यों है ऐसा, क्यों करना चाह रहे हैं और क्यों ये सब चीज़ें हैं कि रिसर्च कर करके जो हम बताना चाहते हैं और हम ये बताना चाहते हैं कि सरकार जो है वो सब चीज़ें नहीं कर पाती है और वो करती भी नहीं है और उसको पता भी नहीं है। और वो जो महिला है, परिवार है, उसको हम देखेंगे तो उसको कोई दूर दूर तक जानकारी नहीं है उन चीज़ों की कि मेरे लिए ये योजना बनी है। पहली बात तो कोई योजना ही नहीं है डोमेस्टिक वर्कर के लिए। फिर भी यदि कोई बनी है योजना जो जनरल योजना है उसमें आप शामिल कराना चाहते हैं तो उसको दूर दूर तक कोई लेना देना नहीं है, न उसको जानकारी है। उसकी लाइफ इतनी पेचीदगी भरी है कि वो सुबह 5 बजे उठी है, उठते ही वो फटाफट तैयार होकर काम पे भग रही है और फिर उसको नहीं पता है कि आज सुबह मैंने जो तय किया वो शाम तक होगा या नहीं होगा। वो बदल भी जाता है, दिन में 2 बार भी बदल सकता है, 3 बार भी बदल सकता है। तो उसके बीच में यदि इस तरह की रिसर्च हम करें और करके हम लोग पॉजिटिवली उसको अब लेके हम देखेंगे कि ये चीज़ निकल रही है और इन चीज़ों के ऊपर हम आगे कैसे काम कर सकते हैं, तो वो काफ़ी अच्छी एक इफेक्टिव रिसर्च होती है।
जी बस Meva ji says that it's important to understand that for a research like this, even as the process of research is ongoing, the feedback of how the information that is shared during research is used by the members, the domestic workers themselves. So in the conversations that have happened about lactating mothers, about mothers who are not able to lactate or have some other issues, they are constantly using this information, and that we can see. However, to be able to capture it in a workshop which wants to record some feedback of the impact of research quickly may not be possible. How it is possible is by the presence of an organization like hers, which is in constant conversation with this group. So the women can talk very freely to them and are coming back to them. And also talking to them about how are you going to do this research? What are the interventions that we can design using this research? And that is a very a big role, a big impact that we see even as we are continuing with this work. Thank you.
So Meva ji ने ज़्यादातर बातें बोल दी है. I'll just add a little bit to what she was saying about the workshops. When we were on the ground and we said we would do something like that, the workers and also the folks from the union said we want to do something with men. Everyone comes in and does something with the women, but they said someone has, like, we have to go back and talk to these men who are not in the similar circles, or no one's trying to engage with them to improve their understanding of things, which we couldn't pick up immediately. But in the process of doing the workshops, a lot of husbands or their brothers would come in and drop their wives, and they would stick around, or they would hear about it from their wives. And some of them called back the union members and said, "Oh, so what can I do to help her? I don't have regular work, but she does. But what can I do to take care of his feeding practices, or how can I play with him?" So it was interesting that there we might imagine like it to be more tense and more difficult than it actually is to get through to them. That was one reflection. The other one was the way how she said, like, you shouldn't give things, because then in their life form, it, like, the understanding or the so much takes a back seat, and some of them might associate work of an organization with things. But what also came out of this that was very interesting, and it was possible because they have an infrastructure already in place, that instead of giving them these things as private goods, we give them as a community product. And for this, the community leaders in various settlements and also the women were very keen to test out something like this, where it would be kept at like one place in a settlement, and that over time maybe even becomes a space where young mothers could come in and talk to a community leader. So that was also interesting to test out a delivery mechanism, which we'll do in the coming months, to give something out as a community good versus a private good. And the third one was about the framing itself. So the research is oriented and does specifically talk about how women would cope with the competing decisions between child and work, and we do find out that they do give the most priority to work because it's resources, it is livelihood, it sustains their family. The next comes the child, and then it is her own self, if there is. But in doing those baseline surveys and interviews and constantly going them, we also had to rethink that we cannot only see the competing needs between these two, but also think about how they manage their lives itself around this perinatal period, the last 6 months versus first 6 months. Like, how do they decide how to reduce work? How much work do they reduce? How much money do they need to make that transition between having a maternity break versus not having a maternity break? And a lot of the other identities of being a migrant in the city. So I skipped the part which talks a little bit about the sample, but of the 153 women, 136 of them were living in rental housing, and only 7 of them were from either Rajasthan or Jaipur. Most of them, about 75 of them were from Bengal, and the other were from UP, MP, and Bihar. So they face a lot of discrimination within public health services. They report a lot of this discrimination. They also become ineligible for a lot of welfare schemes when they cannot produce adequate papers, or they report some sort of discrimination there. And their migrant status also makes them a lot more vulnerable in their relationship with the employer itself. Similarly, the fact that they want to deliver in a private sector, like Mewaji said, means that they have to gather about 10, 15 to 20,000 rupees for that period itself. And it often means that there's a debt right at the stage of child delivery, which means the next couple of months she's also thinking how she can repay this debt. And this sort of has become a major stress, both these concerns. One, how will she finance her delivery, and also the stress of what kind of service would she get when she goes to a private clinic or to a public clinic. And what we figured out was there were a lot of early marriages in this population, and a lot of them were marrying under familial pressures, both men and women, which created a tension at home where the men were not, like, they were a little hesitant to take up marital responsibilities or parental responsibilities, and many of these women were still trying to find their voice, and they couldn't assert what they want, what they need. And they were operating within this in the first initial years of the child care. So that was also something that was shaping how they react to it and how much they can do around this. So my only closing thought from this is just talking about how the entire process played out. A lot of it was possible because it wasn't a very terse short-term relationship that we had with them, but it was a constant back and forth. And so just to think about, like, can such study designs allow these terse relationships to be a little more spread over time and deeper in some ways? Do these approaches push a research to be more responsive to the ground? And does this change the nature of what we find important and what we don't find important when we go and research in the field?
So I'm just going to do a small summing up, and then very small summing up, and then a set of questions. I think there are 2-3 things that have been highlighted in all these presentations. The one thing is about the centrality of women's work and how critical it is for her how critical livelihood is, and what are the balances that she has to do, and even for as a barrier to breastfeeding. I think that is one thing. But also the important thing in which came out also was the stress, both in terms of mental stress and economic stress that it puts on the household. A childbirth puts on the household, and how women cope with it, and how it also is influenced by where in the terms of economic situation there are. And the third very important highlight is this combination of a workers' organization and research, and how the very process itself can be an enriching, ongoing process. So with that, I'm going to close and open up for questions. No questions.
So my question is, I think it can apply to Divya and to Antara and Mewaji. I want to know, what is their access to breast pumping kits and the awareness, considering both are working with organizations. Of course, Mewaji के साथ organization like आपके workshops हो रहे हैं and information dissemination हो रहा है. But in terms of your work, I'm wondering, you know, I mean, I do understand that breast pumping is not very accessible, but if that can be.
Oh, to repeat. The question, if you didn't hear it, it was about whether breast pumping and the use of breast pumps is a possibility, especially because of the organization linkages which could increase access to it, so that women could pump and store and work and someone else could feed.
My question is also connected to the last speaker who talked about breast pumping. And I'd like to ask you, how did poverty prevail in your study? Because the access, for instance, to breast pumping is also a question of maybe if you're able, your economic status might allow you to buy a breast pumping kit to enable you to probably save some milk for the child. But it's like poverty, urban poverty really prevails in all this, and it reduces the choices of these women. How did this play out in your study? Thank you.
Hi, Namaste Mewaji, and hello. I'm just curious to know, from the onset, were there any family planning ideologies that were disseminated beforehand or as a group recognized? Like, औरतों को पता था फैमिली प्लानिंग के बारे में या फिर नहीं, या फिर अंडर पॉवर्टी की वो हो जाता?
One round. Yeah.
Yes.
Breast pumping is at the construction site. I mean, it's these are some of the debates that we've been having, with Ajivika and the kind of research that I've been doing. For the longest time, creches were sort of the best solution for most informal work sites, whether a factory or a construction site. But then increasingly, this realization that for children under 6 months, the creche has no meaning because the mother wants to be close to the child to be able to breastfeed. And with breast pumping, the one is it's culturally not a subject that women are open to. But two, infrastructurally also, if you think of this as a migrant community that doesn't have access to basic water, and then things about like how do you clean the breast pump. It is one thing to come up with an intervention like this, but then if you want to think about all the steps that would be required to be able to do something like this. How does one sterilize the bottle? Does the woman even have time to breast? It might be much easier for her to breastfeed the child than actually pump the breast milk. And if she did, where do you store it? In the kind of circumstance, they barely have light at home, so where do you store it, and how does that refrigeration work? So these are some really big questions. I mean, there are also debates about, if not breast milk, then what? Like, can we have formalize something that the organization doesn't want to engage with at this point, because it has huge questions. There are legitimacy questions about the science of it itself. There is no answer to this. It's a large debate, but breast pumps definitely culturally, it's not something that we have been able to talk about, and infrastructurally also it just seems like we would add an additional burden that we already see with bottles. As they give cow's milk in bottles, there's already huge questions about hygiene, the fact that these bottles cannot be sterilized, the fact that an older child is feeding the baby with the bottle. So the whole idea is not workable at a construction site as of now.
No. The question about the burden on her time still remains, and in fact it just adds on to that burden also, and on how it relates to poverty, I guess. So a lot of these women had experience with breast pumps in the hospital and after as well. They were buying some inexpensive version of it, because they would say it would cost between 50 to 100 rupees at the medical store, and they reported that after using it a couple of times, their breast milk would often dry up. So that was also their hesitation towards using breast pump. And the other was, as she said, it's not so much about whether they could buy or not, because when they do see the value in the product, they can shell out that much amount. Like usually you could buy them at 1,000 to 2,000 rupees in the market, and they would do it. But the questions about time, and like you said, the infrastructure, whether they have a fridge, they don't have a fridge, all those questions. So
ये एक ये भी निकल के आ रहा था जब बच्चों के पंप से दूध पिलाने वाली बात में कि ठंडा दूध है कैसे पिलाएंगे, उसको गर्म करेंगे, पीछे से कौन संभालेगा, और हमारे लिए तो एक काम और बढ़ जाएगा, ये भी था। और ये रियलिटी है, यदि हम ग्राउंड पे देखेंगे तो ये नहीं चल पाएगा, इस सेक्टर में नहीं चलेगा। जो अनऑर्गेनाइज सेक्टर है वो डोमेस्टिक वर्कर है, कंस्ट्रक्शन वर्कर्स है, इसमें तो बिल्कुल ना के बराबर हम बोल सकते हैं कि उनको हम कंडीशन देखते हैं उस आधार पे वो ना के बराबर है। दूसरा ये जो आप पूछ रहे थे फैमिली प्लानिंग का, महिलाओं को पता है कि फैमिली प्लानिंग के बारे में जानकारी है, और यहाँ तक है कि अभी जो यंग जो महिलाएं आ रही हैं वो चाह रही हैं कि एक ही बच्चा हो, वो दूसरे बच्चे की डिमांड भी नहीं कर रही है, पर परिवार में उसकी नहीं चल पा रही है। तो हमारा दूसरा स्टेप ये है कि हम पूरा कम्युनिटी के साथ कैसे काम करें, और उस कम्युनिटी को आप कैसे अवेयर करेंगे कि आप लड़का और लड़की वाली जो बात है हम लोग कितना ही बात कर लें, पर वो जाती वहीं पे है। यदि आपके लड़का नहीं है तो फिर वो वापस वो कहेगी नहीं अभी इस बार और चांस लेंगे, इस बार और लेंगे। तो वो एक तो उसकी उसमें है। दूसरा ये कि उस महिला को समझ आ रहा है, और खास करके जो डोमेस्टिक वर्कर है वो कई तरह के घरों में काम करने जाती है, तो उन घरों के कल्चर को जब वो देखती है, उनके बच्चों को जब देखती है, फिर वो आके कंपेरिजन भी करती है। हमने ये बहुत ही नज़दीक से देखा, वो कंपैरिजन करेगी तो वो चाहती है कि मैं ऐसी ही मेरी लाइफ हो, ठीक है मैं काम कर रही हूँ, वो काम है मेरा ये काम है, और इस काम में मैं और ज़्यादा कैसे हुनर पैदा करके अपना और ज़्यादा कैसे कमा सकती हूँ, पर मेरे बच्चे ऐसे हो, वो ऐसे नहीं हो कि वो भी कल इसी श्रेणी में आके काम करें या कोई साइड पे जाके काम खोजें, या मेरी बेटी आकर के इस काम में आए, वो नहीं चाहती है। तो उसको आ रहा है, पर उसके जो परिवार में मुखिया हैं, पति हैं, उनके साथ अब काम करने की ज़्यादा ज़रूरत है। और हमारे तो उन वर्कशॉपों में निकल के भी आ रहा है, वो ये कह रहे हैं कि ठीक है हमको समझा दिया आपने, बात हो गई, हम समझ भी रहे हैं, पर हमारे बाकी के लोगों के साथ काम करो, उनको समझाओ, खास करके जो हमारे हस्बैंड है उनके साथ तो आप अच्छे से उनकी क्लासें लगाओ। तो ये एक निकल के आ रहा है, और ये करना पड़ेगा। यदि ये हम कर पाते हैं, और हमने कुछ जगह किया है यूनियन में, जब किया तो उसका हमको पॉजिटिव रिजल्ट भी मिला है। उसके हस्बैंड की तरफ से कॉल आता है कि आप बताइए आपकी वर्कशॉप किस दिन होगी, मैं मेरी पत्नी को जरूर मैं छोड़ के जाऊंगा, और वो स्कूटर पे, साइकिल पे, ऑटो से छोड़ के जाता है। तो ये एक पॉजिटिव बात है, और ये होगा। हम सब यही होप रखते हैं कि बिल्कुल बदलाव तो जरूरी है, और वो होता है। यदि छोटा सा एक चीज आती है तो उसके इर्द गिर्द बहुत सारी चीजें निकलती हैं, बदलाव होते हैं। थैंक यू।
You want me to do it? Translate it? So you can just a quick translation on the side. So Mevadi says that in her estimation, breast pump as an infrastructure will add an additional work burden on the women, and she doesn't believe it's a viable solution for informal workers. She also says that on the question of family planning, that the women are actually very aware. And that in fact the family planning norm of 2 child per norm is not the one they're thinking. Many of the younger women only want to have 1 child, but they are not able to exert that influence within their household. So one of the questions that they are constantly challenging the union to do is to begin working not just with women, but to work with the communities. And the union is struggling to think about how they change the focus of their work as a domestic workers union to start then working with families and communities. And one of the second thing she said is that you're also seeing a big change in the younger workers who are looking at the culture of the households they work in and looking at the children of their employers and using them as aspirational pathways for their old child's life. So you're also seeing a generation that doesn't necessarily want their children to follow employment pathways that they own. They don't want them to follow them. And they're also saying, I want my children to be like this. So a lot of the questions about that employment space are also shaping aspirational imaginaries of their vision for their child. And one of the things that they're coming back and saying to us in the workshops is to say, we are getting it, we get it, but telling us is not enough. So you need to bring in the other members of the household, you need to bring the men to the household. And Mevadi saying one positive change has really been that many of the men have been responding, as Antara was also saying, that the husbands are calling and saying, tell us when the workshop is. And what we've been seeing, we did one of the workshops last week actually, and what you see in the beginning of the workshop is a stream of people where the husbands are coming, some of them are coming and dropping their wives to the workshop and then sticking around. So they're coming on the auto, they're coming in cycles, they're coming on scooters, and there is a kind of trend of that positive enrollment. So they're thinking about how to, and they're calling them and saying, we want to be more engaged. And so she's saying that change is absolutely necessary, and we're beginning to see it, even if it's these small incremental spaces.
Thank you very much for the presentation. My question is two. One is it's more general in the sense of, is there any public policy which is really focusing on these issues, and how has it been performing in practical terms, and what are the issues in this policy? Two is, what is actually the general debate in the society? Is the society just simply laissez-faire about this? Is there a debate going on about these issues? And I know Indian society is quite complex and there's own social cultural environment, but what is actually the general debate in the society about these dynamics?
Hi, thank you to all the panelists first of all. My question is for Divya. I'm wondering if I can request you to say a bit more about shadowing as a method, and it's really interesting for me as a student, especially the kind of detail and insight it offers, especially compared to sort of the recall method. But I'm also wondering about what you reflected about, the sanctity of the method versus sort of the agency that people had to sort of refuse. I'm wondering if this played out in any other ways, like was there any other downsides of the method? Did they feel surveilled at any other scale, and did they have the chance to refuse on more than a day-by-day basis, for example? Yeah.
Thank you very much for the very informative presentations. Really, traveling is learning, so I've learned a lot about urban employment spaces and particularly construction. My question is about thinking beyond understanding the challenges of child health at construction sites. And in line with the questions raised by Divya in her last response, what are your thoughts, and this is to all of you, about bringing decency to this kind of work, to the informal employment, such that it improves lives of all the actors that you have directly talked about, but maybe not explicitly. I see that in as much as the focus is on child health and breastfeeding, the impact is felt by the child, by the woman, by the family. That is in some situations, as you presented, the husband and the wife working together, but also by the passive actors in this whole urban construction site space, who are members of the family that may not be at the construction site. So have you thought about research questions similar to those you've raised about the pumping, that would help understand how to bring decency to this kind of work that could positively impact the different actors in this space? The second question, a very short one, is curiosity about relating some of the findings. The statistics are really stunning about women who return to work within months, 1 or 2 after giving birth. Is there a standard time given to a mother before she returns to work as a benchmark for understanding the interpretation of this time period? Thank you.
I just want to express my appreciation on the research process in which you involve the community and found that the process actually make a way to change and have a better quality also from research, because I think this is extremely important, that no matter how poor or terrible the situation of the people are, they are not to be studied by the other. And this is quite important. What I like to ask is, with this process, how could you bring that process of research with participation and empowerment into the normal research? How you change the quality of your research, the conventional research as such, that we study something, we interpret, we make the meaning of things without people have to say anything at all. But here she said very clearly, and thanks so much. As a community, you tell the researcher in this room that the research have to be done in such a way that let us talk, let us do the research. My question is how this this way that you learn from this empowerment research bring this quality into a conventional research in the normal case, and how could we improve that? Yeah, because the conventional research is more static. We want to understand the deep aspect of things, and things are static. But the people involvement in the research is a dynamic knowledge, from problem to change, to new possibility, and to adjustment. Is a pathway to make a better knowledge which relate between different issues together. So just the question to you.
Hello. Yeah. So I had two quick questions. One is any construction project. Okay. The first 30% to 40% is labor intensive. Okay. In that case, it may vary from 6 months, 1 year, 2 years, depending on the size of the project. So at that time, there is also an uncertainty associated with the employment of the household themselves. So are you did you come across any kind of this question also? That okay, in period of 6 months, 1 year, I have to even shift to some other place, but then how I should start, and as a household I should start thinking about that. That was one question. And second question आपके लिए था मैडम, तो मुझे पूछना था कि जब आप प्रोजेक्ट्स और ऐसे वर्कशॉप्स करते हैं उसमें तो वहाँ पे बेसिकली वुमेन ओरिएंटेड सारे वर्कशॉप्स होते हैं, तो इसमें आपने एक अच्छी चीज़ बताई कि मेन आर ऑल्सो रिस्पॉन्डिंग, मतलब हस्बैंड जो होते हैं वो लोग भी काफ़ी कोऑपरेट कर रहे हैं, पर उसी टाइम पे आपको कभी ऐसा रेजिस्टेंस या कभी ऐसा विरोध मिला क्या किसी हस्बैंड से या लोगों से, जहाँ पे वो लोग बोल रहे हैं कि नहीं आपको वहाँ नहीं जाना है, और आपको फिर ऐसा लगा कि हम वुमेन को तो हम पढ़ाते हैं बताती हैं चीज़ों के बारे में, बट उसी के साथ में हमको आदमियों को भी बताने की ज़रूरत है और प्रोजेक्ट में वो भी हिस्सा लाना चाहिए, इस बारे में आपके कुछ विचार सुनने थे मुझे. थैंक यू. Yeah, so the second question was, she wonderfully told that the husbands are responding very positively in some cases, but at the same time the project or the workshops may not have a vertical where they will consciously tell the husbands also or educate the husbands also. So I am asking that whether there have been any instances that a lot of resistance was from the husband side, which actually stopped the project or stopped the women from going to this workshop or these places, and what are they trying to do in to incorporate the education of the husbands or the male parts also. Yeah.
So to respond to the policy on for women in the informal sector, currently there is one policy that sort of talks about wage compensation for the number of days that she has stayed away from work immediately after childbirth, but the amount is absolutely inadequate. Like a woman would earn more per month than what she's compensated for in the 6 months that the policy allows. So it doesn't make sense. You know, if you just did a simple cost benefit analysis, it makes no sense for the women to stay at home because the compensation is very low, and two, because these are migrant women, at least in the construction sector, it is very difficult for them because the policy is also a conditional cash transfer scheme. So they have to do X, Y, and Z before they have access to the money. But because they're constantly moving, they aren't able to follow up on those steps that they have to do to get that money. So very often, you know, it just falls through after the first round of compensation. In terms of the method, Neha, I have lots of reflections, so we'll have a conversation some other time. But one quick one about surveillance. This was something on my mind always, you know, like how does a woman feel when I'm constantly following her? But at a construction site, the contractor is constantly surveilling her work anyways. So I realized maybe the sense of surveillance, like from me as a researcher, was more when I was at her home and I was always careful, and there was always somebody with me who knew the women well through the creche work. So it wasn't me as the primary person of contact, but the creche worker, and I was sort of the person who's accompanying and just taking notes. But my surveillance, if I want to call that, sort of got reduced the minute we entered the construction site, because then it's the contractor's surveillance that she's worried about. Then my presence doesn't matter. It only matters to the contractor because he wants to make sure I'm not clicking pictures, I'm not wasting women's time. Then I become really unimportant in the construction site. So in that sense, I think we were able to be careful about that. But yeah, this is something that I've thought about quite a bit, and I'll answer your other questions later. Maybe we can talk about it. In terms of return to work, no, there is no mandatory, time for post-childbirth return to work for the informal workers, and that's something. I mean, there have been lot of conversations on it. Diego has been a part of it. Several organizations have been talking about it, but for women in the informal economy, it remains very, very low. Any kind of maternity protection, except for that one policy I spoke about. I completely agree with you on what kind of the ethics of doing this kind of research. And as I was trying to say, these are migrant women, so the idea of being embedded in the community, the chances for it is very little. So this kind of a feedback mechanism through a research process, there are very few opportunities for that, which is why what we try to do is, at least the way I have been approaching work, is to try and pick up questions that have emerged from previous work. So it is not like a question that only I am deeply passionate about, but it is also a question that we know that the not-for-profit organization that's working with construction workers is also troubled by. So it's a question that we've arrived together. It's a question that we sort of think is important in addressing some of these concerns. I agree with you, but opportunities for this kind of like feedback, this kind of iteration is just limited because I don't get to see the women after 3 months. They are gone. They are at a different construction site. And I think that was also a question somebody else had posed about, do they have this insecurity? Manav, that was your question. Well, that's the given in a construction sector. And I think a lot of seasonal migrants have over time adapted to this kind of work. And I think they're also, it's something that they like because they want to go back home. So these are short distance, short term seasonal migrants, which are very different from long-term male single migrants. That's a very different category of migrants. These are family-based migrants. They migrate together with the children, husband, wife, sometimes, extended family members. And the seasonality and insecurity is sort of something that they have, it's accounted for in the way they think about it. And the contractors are sort of the ones who control this. It's not so much the workers, because the contractor is the one telling them where is the next project going to happen and how do we move there. So that relationship between the contractor, which we as researchers, we would think of contractors as there is this whole impression of them, and I'm being careful about the words I use here because this is being recorded, but it's, we may think of contractors as certain people, but for the workers, the contractor is also a very important person because he's the only one who will give them advance money when they need it. He's the only one who's going to give them any credit when they need it. He's the one who's going to get them best job opportunity that they want. So that relationship, I have also realized over a period of time as researchers, we have to be really careful in how we articulate it. How we sort of think of this insecurity and vulnerability, it's not, completely in one shade. There are many shades to it, and we need to account for all those shades when we do research.
just add to the larger questions that were asked. And I think what this study, and that is the value of this study, is that the linkages that they are making with income security and economic security. And I think that's a very important factor. So a woman may get a cash transfer for maternity benefit, even if it is adequate. If she is a street vendor and she's going to lose her space for vending when she comes back after 3 months and has to start all over again, and she may not find a place for another 2 months. In addition, she's had some out-of-pocket expenses in during childbirth, etc. It puts her at a very disadvantageous position, and she will come back if she can a little bit earlier to secure that place. The second issue, so we have to understand this whole issue in the context, in a larger context of income and economic security. And insecurity is a part of, it defines almost informal employment, but the role of a mediator who is almost always from the community, larger extended family, and that role also needs to be understood to understand what kind of security, quote unquote, he can bring to this relationship of insecurity of work. And the third thing I want to say is this whole thing about not where they work but also where they stay. So when we talk about breast pumping and maintenance and hygiene and electricity connection for refrigerator, all these things where they live has an impact on the decisions that they make, both in terms of the processes, social protection mechanisms that they will adopt, and also on the kind of work that they will choose, or when they will choose to go back to. So just that.
ये जो महिलाओं के साथ में जो पुरुषों को हम लोग बुलाते हैं मीटिंग में, तो ये विरोध इसलिए नहीं होता है कि शुरुआत में हुआ था जब हम लोगों ने यूनियन का काम शुरू किया, तो वो कहते कि महिलाओं को पता नहीं क्या बताने वाले हैं, क्या करेंगे। तो हम लोगों ने क्या किया कि उसको ओपन कर दिया। हमने कहा कि आप आइए और आप आके सुनिए, हम अलाउ नहीं करेंगे कि आपको बोलना है, बोलने के लिए अलाउ नहीं करेंगे, हम आपके सुन सकते हैं, बात कर सकते हैं। इसके बाद यदि आपको कोई दिक्कत लगती है तो हम अलग से आपसे बात कर लेंगे। तो एक तो ये था कि वहाँ पे जो हमारा जो धरातल है वो काफ़ी पहले से बना हुआ था और एक विश्वास है, ये सब चीज़ें थी। दूसरा ये था कि वो उनसे ही इंस्पायर होकर के वो आ रहे हैं कि अच्छा यूनियन के लोग हैं तो हमको कुछ नई चीज़ सिखाएंगे, छोटे बच्चों के बारे में बता रहे हैं, बात कर रहे हैं, तो इसलिए ज़्यादा दिक्कत हुई नहीं। और जब हम लोग वर्कशॉप कर रहे हैं, छोटे बच्चे साथ में हैं, वो 2 बच्चे भी हैं उसके, तो दोनों को लेके आ रही है, तो हमने कहा कि संभालने के लिए किसी को आप घर से एक को लेके आइए वर्कशॉप के अंदर, तो साइड में आप बच्चे को लेके बात कर सकते हैं और उधर वो महिला वर्कशॉप में भाग ले सकती है। तो उसमें आए थे, उनके पति भी आए, कहीं के कोई ससुर थे, कोई सास थी, कोई माँ थी, बहन थी, जो भी था उनका रिलेटिव आए। उनको अच्छा लगा कि ये तो ऐसा कुछ है नहीं कि महिलाओं के खिलाफ कुछ बोल रहे हैं या उनको कर रहे हैं। ज़्यादातर मैं बताऊं दिक्कत क्या होती है कि उनको ये लगता है कि महिलाएं हैं तो वो हमारे घरों के बारे में बातें करेंगी। यदि मैं कुछ मारपीट कर रहा हूँ या गलत बिहेव कर रहा हूँ तो हमारे खिलाफ वो कुछ बातें करने वाली हैं या बताने वाली हैं, जिससे वो आके सवाल जवाब करेगी या वो बोलेगी कि ऐसा नहीं चलेगा। उसमें ज़रूर दिक्कत आती है, तो वो भी हम करते हैं और वो भी ओपनली हम करते हैं, उसको बैठा के भी बात करते हैं कि अब आप चल रहे हैं तो परिवार में दोनों की ज़रूरत है। यदि आप महिला के बारे में उनको नहीं समझेंगे और आप उनको अपना कैसे घर चलाना है, कैसे बात करनी है, उनके क्या राइट्स है, उसके ऊपर आप नहीं समझेंगे तो आप नहीं चल पाएंगे। तो वो दोनों साइड हम देखते हैं और ऐसा अभी तक तो नहीं आया विरोध। शुरुआत में ज़रूर आया, तो वो शुरुआत में आया तो हम लोगों ने चैलेंज भी लिए और हुआ भी, और अभी ठीक है। इसके बारे में तो इतना ही है कि वो कोऑपरेट कर रहे हैं अभी फिलहाल की स्थिति में।
Briefly, that in the initial years maybe we did face, but what we did was that we opened up our forums for men. Men could not speak, but they could attend and see what we were talking about. The second thing is a larger fear amongst men is that people will talk about household affairs, domestic violence, etc., which sometimes we do, but it's that conversation is with 2 people and there's some kind of engagement around that issue with both the family members. And third is what Mewaji says is that we've been around for a while, we have a relationship of trust with the community, and that helps us. So I think with that very promising note, we are going to close and thank you very much.